So, welcome back to another episode of the Wild Wisdom Podcast. I'm your host, Alyssa Finning, and today I have a very special guest, a dear friend of mine, and another owner of a wellness center in Kokomo, Indiana. She owns Moving Towards Balance and is a renowned chiropractor and craniosacral therapist. In fact, it's really hard to get in with her. So, if you listen to this episode and you really want to see her and you're in the Kokomo or Indianapolis area, you're going to have to book way in advance because she's amazing. So, we're going to talk today about craniosacral therapy, maybe a little bit about chiropractic, and just go from there. So, tune in and check out all the knowledge that Cheri is going to share. Thanks, Cheri, for coming on today. I appreciate it, and I'm excited for lunch afterwards. That's the thing about being here at the Village Recording Studio in Broad Ripple, is because I get to, if I'm interviewing someone here, we get to go to breakfast or lunch afterwards, and so that makes it more fun for me. So thank you for being here.
Thanks for having me.
So I always like to know, because you have a plethora of modalities that you work with, which makes you extra special as a doctor of chiropractic, because you can pull from your toolbox. That's the euphemism I usually use. And you can really cater to your patients and what they need. But tell me and our audience first a little bit about what led you into this practice of holistic, it's not all holistic, but kind of that holistic side of medicine.
Well, I started in massage kind of by chance. I had a friend who was a massage therapist, and I started working on her because she didn't have anyone to work on her. And she said, "You're pretty good at this. You should probably go into school." My dad was a surgeon, and my mom's a registered nurse. So Western medicine was in my background. Mm-hmm. So it seemed natural. And then when I got into massage school for the first time ever, I actually loved school. I was interested in anatomy. I just kind of started gobbling it up. But I was very clinical minded. And so I got into that piece. Mm-hmm. My teacher saw the subtle energy parts of me, but I didn't recognize them yet. So I just needed to know, I want to know how joints work. I want to know what things are called. And I wanted to know the structure and function. So that's really kind of how it started.
Sure.
In body work in general. Mm-hmm. And then I wanted to teach. I've always had a passion for teaching because I've always had learning problems, learning disabilities. So I wanted to help other students learn kinesthetically, auditory, visually, and bring those pieces into a classroom because it was hard as a child to learn being a kinesthetic learner. So I went into teaching and got into massage therapy out on the West Coast rather, and taught in Portland, Oregon. And so from there, I just continued to study more bodywork modalities.
What got you into doing your doctorate in chiropractic?
I moved to Portland. Actually, I got accepted into a naturopathic medical school. Mm-hmm. So I started out there, and after a semester, I decided one of my teachers said it's about 20 hours a week you'll see patients, and 20 hours a week you'll be formulating supplements and herbs and homeopathics. And I was like, I don't really want to spend 20 hours a week sitting looking at blood work and figuring that stuff out. I wanted my hands on my patients all the time. So my advisor said you should either probably go the PT route or chiropractic. And while I was teaching massage school, one of my friends who I taught with had moved out to be a chiropractor. So she said, we both moved to Oregon to be doctors. Let's just do it together. So a shout out to Cheri for pushing me to go back to school.
Go Cheri.
Yeah. So that's how I ended up in chiropractic school. And it was a wonderful education. It was kind of a brutal education. I did a 4-year program in 3 years, which was a lot.
Oh, yeah.
And my body took a beating just because I'm pretty hyper flexible. I've done yoga since the 90s. So my ligaments are not very, don't have good structure. And so after being poked and prodded for 3 straight years on the table with other chiropractors, a lot of them, it's a male-dominated profession. Mm-hmm. So they're a little more aggressive than us females in the profession typically. Not always, but I realized that it was really hard on my body. Mm-hmm. So coming out of chiropractic, I started feeling the need for more subtler ways to do body work. And by this point, I'd been introduced. I'd done Reiki 1 and 2, and I'd done cranial classes with a doctor in Michigan, and then I studied out there in Oregon with a doctor on the West Coast as well. So I've done 3 types of cranial training, but I just kept getting drawn back to the more subtler energy approaches because my body couldn't take the hard manipulations. And even deep tissue massage, I would get up off the table and with my background of my body issues that I have, I couldn't stand up straight. You know, it hurt my body. So I was like, I'm studying this stuff and it's not helping me. So what am I missing?
Well, and it's a lot of times, I mean, you know this, I know this because we spend a lot of time together talking about this. A lot of times it's what we go through and our bodies, our minds, whatever, that lead us into studying more and then really arm us with how can we help our clients, our patients, even more so. So tell me more, because I know you've studied a lot of different things, but going and studying the craniosacral, tell me how that evolved and even explain for the audience what that is.
It started right when I got out of massage school. So this was 1997. And Dr. Keith Barber is up in Michigan. He's a fantastic osteopath, and he was teaching at the school. And he was teaching a cranial class. And what he was teaching us as massage therapists is what he called, I don't even know if he calls it this anymore, but floating the bone. So you would find the hard spots in the bone and you would treat bone like any other tissue. It has restrictions, it has softness, it has, you know, firmness. And so you would allow that bone to kind of soften and unwind and move. So that was my first introduction to, oh, wow, I can just apply a little bit of counter pressure and allow the body to sort of reset itself. So that was the first concept of that kind of concept. And I continued to study with him, and then I was turned on to the osteopathic, you know, philosophy, which again, like chiropractic, some are very aggressive and some are very gentle. And that seemed to work for my body. It was kind of like, I just need a little nudge. I don't necessarily need anybody to come in and, you know, bring the elbow down on me. So then when I moved to Oregon, I studied with Salehin Tom, and he did cranial fluid dynamics. And they incorporated hand mudras, lots of hand mudras. It was very complex system, really interesting, harder to do because there were so many pieces that you had to follow a book and muscle test for hand mudras. But again, more information, you know, so you're just, now I look back and I think I always added philosophy to what I knew with a little bit of tools. And then I decided to go, because I kept telling people I did craniosacral and everybody thinks up-ledger. So I thought, I'm just going to go study up-ledger because that's what everybody knows. So that was my third sort of training in cranial. And I've been through the advanced 1 course in that program. And then I kind of went back and revisited Dr. Barber. He's still teaching. So I went down to Lexington and did his program again, which had evolved a lot in 20 years. And it was great to reconnect with him. Now that I have the chiropractic background, so much more knowledge to understand cranial. So what that is, your other question is, the dura that goes around the brain and the spinal cord is called the dura mater, which means tough mother in Latin. It's a waterproof barrier, so it keeps all the cerebral spinal fluid in around the spinal cord and around the brain. And it's kind of like if you have injuries, you can it attaches to the sacrum down by the tailbone. It attaches to the second cervical vertebra and all the different bones in the skull. So you can have a whiplash injury that can affect your sacrum. You can fall on your butt. I have a lot of patients that have fallen off of horses and they can end up with chronic headaches. It's like pulling on one thread of a sweater. You know, you pull on the bottom of a sweater and it affects the shoulder and then it affects down the arm. So when people lay on the table and get craniosacral, I may be working on their head and they say, I feel my knee release, or this is so crazy. Like, is it weird that I feel this in my foot? And it's like, no, because you're a matrix of connective tissue. And as we unwind the deepest structures, it allows everything else to release. So for me, the concept of craniosacral, in my own words, is we're treating from the deepest part of the body, which is, the deepest nervous system, and it spirals out. Whereas massage and chiropractic are a lot of, we're coming from the outside in, and I'm manipulating from out here to affect the nervous system on the inside. So that's just my different feel about.
Yeah, that's a great explanation for everyone. And I wasn't really understanding craniosacral until we actually went to Arizona. And because you and I, when you have things that we do, and we don't always just talk about what we do, right? We're hanging out and doing other things. And so I remember, and you probably remember this too, when we were at the Coaching with Horses retreat. And that second day, I signed up for the craniosacral, the equine craniosacral. And I was like, I don't know, I've never done this, but everything else is full. So I felt like it was meant to be. And it was one of the most amazing, wasn't really a class, but sessions that I did. And I loved it, absolutely loved it. So it made me go, oh, I need to get this done on myself. And I know that you've said that you end up doing more craniosacral now, and that you just explained that because of how effective getting right to the internal and the nervous system and everything and spiraling out. I like that analogy. And also the subtle, working on the subtle and how profound the subtle can be. And in fact, that experience for me and knowing that you do it has really made me want to learn more. I don't know if I'll ever really learn as much as you, because I don't know if I want to go down that path. but just to have another tool, because I think it's so effective. And for me, when I had went to get it done with a friend here, and because I know you're always booked up, which is a good problem to have. But I realized my sphenoid bone would get out of place. And I could go into all of this, and you know this too, and how it's related to my pelvis and yada, yada, yada. Won't go into all of that. But I was just blown away by all of that, and then gives me a greater knowledge, and it also gave me a greater knowledge of when I'm working with my clients and when they come in with a shoulder issue, and because we already know, the fascial tissue and all of that connected, but just every part of the body. And that's what I try to explain. One reason why I have this podcast is to help share this with people so that they know there are other ways that they can get help. Because without having these conversations and discussing these modalities and how they've been helpful, it's really challenging for people to understand what else is out there unless they happen to find it or word of mouth. So I'm glad that you're sharing that. So tell me a little bit, you can expand on craniosacral in general, and correct me if I'm wrong, but I believe that craniosacral therapy came out of osteopathic medicine, correct?
Yes.
Okay. So you can expand on that, or tell me, maybe some different examples of how you've worked with patients and this has been an effective modality.
I would say, in general, most of us in this country our nervous systems are way out of control. So, and that goes for about everybody, unless you have a practice that you do meditation daily, which is what I'm figuring out. And even then, I had an incident with the meter on the way here, and that stressed me out. So, I think that anxiety, people that are more high strung, so type A personalities, like we wouldn't know anything about that.
No, not at all. Who are those people?
On the go all the time, those people benefit a lot from cranial. I don't think that they let themselves get into that sort of theta state, could get into the delta state that you get with craniosacral, also yoga nidra, because that's come a lot into my work more recently. So I think that benefits anything nervous system issue. I would start with there. That's the most that I treat that way. It can treat people with Parkinson's. It can treat a lot of brain disorders. That's not my specialty. I specialize more in the stress and anxiety, and then chronic pain, because chronic pain becomes a brain thing. It starts out as a brain thing. My joke in my office is it's all in your brain, because people say, tend to say to people with fibromyalgia, oh, it's all in your head. And it is, and we laugh about that because it's become, you have pain for so long, you get this loop that your body can't stop. And so even if your body were to be out of pain, your brain doesn't know that. It's on this hardwired loop. So it's like we have to throw a cog in that wheel to stop that information highway to redirect, which is all neuroplasticity. And our brains can reform and recalculate and change, but something has to come in to disrupt that signal. And so really, cranial is kind of a signal disruptor.
Yeah.
In a good way.
I like that explanation, because I think that's what a lot of people don't understand is, there are modalities that just physically, like forceful chiropractic, or what is it, high velocity chiropractic, and forceful probably wasn't the best word. High velocity will be official, or even deep tissue, because we have a lot of clients come in to Embark like, I want deep tissue massage, and I'm like, oh, you could probably benefit better with this and that, but everybody's kind of got to find that way or get educated. And so just working with that more, resetting the brain, resetting the nervous system, that's what a lot of like the yoga nidra, because we interviewed Stephanie Lopez with iRest yoga nidra, and we both love that, and craniosacral, and the whole approach of yoga therapy is about changing the brain. And people don't always realize that's really the root of it. A lot of these modalities, not all of them, unless they're very physical. If you don't get there, then just like you said, your body is going to still think, because your brain thinks it's in this state. And it's even that whole fight or flight state that a lot of people get into. If you're not changing how the brain responds through the connection of mind and body, then that state will continue to happen. And so when it comes to craniosacral, because I'm curious myself, and I'm sure it varies patient to patient, but how often, I know just having done this myself, I saw results right away, and then kind of noticed if in a week if they stayed, and then into a month and adjusted. But do you see craniosacral as a regular practice, a more treatment oriented, and then maintenance, or how do you see the use of this modality?
I think for me, it's become more of a lifestyle.
Okay.
So sort of with meditation, like you can meditate a few times and you can feel better, but if you stop doing it, then the world keeps piling stuff on you. So cranial is a way to shed layers. And so I think John Upledger said, and don't quote me because this could be completely wrong, but I said, if you removed all the basically samskaras, but he calls them energy cysts, which for those of you listening, if you don't know, these are the problems that we hold on to. You've had a divorce and you swallow that, and you've had stress and you swallow that. And so they just manifest in the body as different things, stress, physical problems. I think Dr. Upledger said if you get... when would you have to stop doing craniosacral? And he said, if you got them all released, you'd probably be dead in 12 hours, because the reality is you could go walk off the curb and step down and throw your pelvis out of alignment. So that's another thing that needs to be treated for. So I try to explain that to people, because with the work that I do, I don't come at it like you're going to see me 3 times and be completely healed. It makes me giggle, and they're like, fix me. I'm like, I fix no one. I'm a facilitator, and I will help your body heal itself, but I don't really fix anything. We have so much to uncover. Sometimes people want to come in and they have knee pain and they just want to work with their knee pain, and that's it. Some people come in and they want to be able to unload and get to the root of who they are. They want to find their authentic self. Those are 2 very different patients.
Yes.
And I can work with a lot. I love to work with the people that want to get to the root, although I'm good at, helping with back pain too. That's my education. But I feel like there's so much more to it. So in answer to your question, I think it's most of my patients come once a month, which is why it's hard to get into me, because they
Sure.
schedule the whole year out.
Yeah. Yeah.
And I see people maybe 3-4 times a little closer together, maybe weekly, when I first start to see them
Sure.
as new patients.
Makes sense.
But then most people continue to come because they get off the table and they feel this. They feel floaty. Probably 90% of the time people say they feel floaty. They feel lighter. They just feel like they've kind of let stuff go. And they have. You don't always have to have, like even with somato-emotional release, which is a piece of craniosacral. I was fearful to go to somato-emotional release class because I thought, oh, it's going to be this big, like I'm going to be blubbering and snotting and crying. And it really, you can release stuff. You can have a few tears roll out. Your body can shake, kind of like an animal does when they're fearful, or when they shake to shake energy off. And then it's gone. And you don't always have to process it. That goes back into the yoga model, the koshas. What level is it on? Is it the mental, the wisdom body, the bliss body? Is it, which most samskaras are on the bliss body level? Is it the physical? Not everything's emotional. Some things are just physical. So sort of my job is to figure out, as I'm pulling all of this stuff in together, which is all the different modalities and techniques that I do, it's just understanding the philosophy and then saying, where is this stuck? If I'm continuing on the body and it's not locked in the physical body, if it's on the emotional or mental body, then let's figure out a technique that we can assist that to be released from that angle.
Tell me about this somato-emotional. Is that, am I saying it right? Expand on that a little bit more, and as a part of craniosacral. Just because I know you've trained heavily in that, and you just mentioned it, but just for our audience sake to kind of understand that a bit more.
When you go through Upledger's class, cranial 1 and 2 are the first 2 classes you take, and then somato-emotional release 1 and 2 are the next 2 levels. There is a concept of, well, it's really, they're adding a psychological component to it. You're not working as a psychologist, but you get trained in a little bit of Jung therapy and Gestalt therapy. So in Gestalt therapy, I'm not putting anything into your head. I'm having you have a conversation with yourself. So if you were to bring up a part that was, say when you were 7 years old, you fell off your bike and you were really embarrassed by it. And something now in your life is bringing up embarrassment. And you're like, oh, I made a total fool of myself. I can't get past this. So then we'll go back and say, when was the first time that you felt embarrassed? And because you're in this, and when I say a theta state, really you're in a state of kind of subconscious when you're laying on the table. We let your conscious kind of go, which is about 5% of us anyway. We're operating from subconscious most of the time anyway. So I say, okay, Alyssa, we're going to go back to that when you were 7 years old. And it's like, how did it feel when you fell off the bike? Well, all the kids laughed at me on the playground and I felt stupid. And so then that's that samskara. That's that scar of feeling embarrassed. So I said, what would you say to the 7-year-old Alyssa if you could say something to her now about falling off the bike? And so today Alyssa would say, oh, you're going to fall off your bike many times in your life. It's okay. Get up and just, if they're laughing at you, just turn around and say, everybody falls off their bike at some point. And then you have now brought a thought from now back to heal that 7-year-old girl so that you can gain part of yourself that you left on the playground, which is also in shamanic work, that's soul retrieval. So you're finding a part of your soul that you've left and you're bringing her forward and going, okay, I don't have to be embarrassed by things because I was still holding on to that. So really, to me, that's what somato-emotional release is. It's a lot of, if people are familiar with soul retrieval, I think it goes into, not to use all these parts, but some people understand different language better.
Yeah, it reminds me of Karen Hellman. I interviewed her on intergenerational healing, and you know her.
Yes.
She said she's come to see you and she wants to study craniosacral, and I said, you can offer to embark, no problem. I will be one of your patients or your clients. And so, but she reminds me of some of the stuff she does in energy therapy, because she combines several things. It's not the exact same thing, but it also goes to show how so many modalities, just some overlap. Not, I mean, yoga therapy overlaps. Some physical therapy components, some psychotherapy components, and the same thing with somato-emotional release and craniosacral. Like, they're not all the same, but there's sometimes some overlaps. And some of that, not exactly the way you explained it, but that reminded me of just some, like, connecting the dots experiences of the example you used of, feeling embarrassed, and then maybe when that happened years ago when you were 7 or whatever, and that brought it up. But I think whatever people can find, whatever modalities they're exposed to that are in a nurturing and safe environment and have a practitioner who is caring for them, that can bring some of these things to the surface and process. And also the same thing you said of, it doesn't always have to be a crying, sobbing, snotty fest.
Right.
Sometimes it is.
Yeah.
And sometimes it's just processes through. And I think I can't say all the subtle work, because some of that does make you just cry and blubber. I'm not sure, maybe if you think about this, are there any differences that you see in some of this somato-emotional release or craniosacral work and just having the processing versus maybe other things where you do come up all all crying and sobbing and things like that? Do you see a difference in what makes that happen, or it's just the way the individual releases? I know I'm just throwing this out there.
No, you're good. I think sometimes the crying, blubbering, and not always, so I'm not ever put anything into one basket, sometimes is resistance. And we could be hiding and putting on a production, excuse me, or theatrics. Some of the deepest stuff that I see get released is really subtle. And it depends, interestingly enough, because I study different types of learning styles for teaching. People release in the way that they have an affinity for their learning styles. So I'm a kinesthetic releaser. So I shake and, vibrate a little bit on the table. I have some people that see a lot of colors. I've had people that have had smells. Some people have heard things. So while you're releasing, they still don't understand how we form memories. They can't figure out how the brain does that. It's miraculous. So when these things come back up, they're not linear. So I think people think, oh, I'm going to have a memory and I'm going to think back to that, and it's going to be a very linear experience. It really isn't. The way that it comes up, it kind of bubbles up to the surface, and it's really beautiful. It's actually amazing. I've learned more about the brain watching people release than I could ever learn from a book, because it doesn't follow anything that you would learn in a classroom. I mean, you can only learn so much, but so I would say I don't see that very often, unless there's a rage and anger component and there's something that you've needed to say to someone that you weren't able to say there was some kind of an abuse involved, or a rape where they were unable to speak, because really your body does that. You aren't able to speak. And they needed to say something to someone who had harmed them. That may come out as a louder, more boisterous, but it isn't the crying and blubbering. It's just get that out, and then there's this calm after it's...
Yeah, I've seen that in clients too, especially with lots of trauma and abuse. And then it's more boisterous was the perfect word for that. But then the subtle as well, and just feeling lighter, the floaty kind of feeling you talked about. Is there, for people to start getting into the subtle parts of the body? And I've interviewed guests, I talked about Stephanie on iRest and Yoga Nidra, and talked about other things. But especially for craniosacral, obviously you need to go see a practitioner. Are there any recommendations in getting into this, like for the general public, not necessarily going to study, but in learning more, getting this done, understanding more, either just in general for stress and anxiety, or maybe even deeper if there's trauma or anything else?
Yeah, for general anxiety and just to relax, I think it's safe for anybody to do that, to go to a practitioner that's had a level 1 or 2 training, even level 1, because some people that are drawn to craniosacral have backgrounds in Reiki, and they can hold what I call a container for you to heal. If there's a lot more issues going on that are deeper with trauma, those type of things, I would probably look for somebody that's had somatic emotional release 1 and 2, possibly into the advanced work. I don't ever say they want people to get certified. I don't get certified because I'd be certified in so many things that it would be hard to keep up on all the education. But there is certification, and you can go to the Upledger Institute and look up for practitioners in your area, and it lists all the classes that we've had. So you can go that route and see who's close, and if if somebody's had 1 or 2 classes as opposed to somebody who's had 5 or 6. And the way I tell people to look for a practitioner is to use your gut. Read the names, feel how it feels to you, call them and have a conversation. You don't have to commit to that. Or send them an email and see what they write back and just see how it feels. Because it is such an individual, you have to be comfortable with the person that's putting their hands on you. And I would not be afraid to ask somebody what kind of work they do. Like, what do they get done? Because the more that I release, the more that I work, the more that I can help other people. I had a teacher say, you can never take a client any further than you're willing to go yourself. So I'm diligent about getting my own craniosacral. I trained with somebody in Indianapolis. I trained with somebody in Fort Wayne. They're both advanced practitioners. And then I do my meditation practice, and I do my yoga nidra daily, and asana practice when I can. I've been bad.
You're not bad. You're still practicing yoga, but
it's true. And
it's hard to, I understand it's challenging to keep everything up. I mean, we're all human.
And amazingly enough, with yoga nidra daily, when I went to my asana practice, I thought, well, this is going to be a train wreck. My balance was spot on. My strength was incredible. And I'd been doing yoga nidra every day. So there is something to be said for the subtler forms of yoga that I wouldn't have believed until my body showed me that we're still very asana focused in the West. And I'm guilty too. And I teach every day, like, that's not what yoga is. It's, a piece. But it's amazing that you can take other pieces of the yoga practice and then translates over to like a really balanced asana. But if your brain's not balanced, your body can be, that's where we've gotten off track in the West. It's like, but look at my body. And it's like, yeah, but what's your emotional health and your mental health like? Because that's a big piece of the picture too. So to me, that's why I say really people need to do this kind of work all the time. Because we have so much I call it unearthing. We have so much to unearth if you're willing to. I think that's why we're on this planet, to work.
I love that you call it unearthing. That's so much more beautiful than dealing with your shit, like I call it.
Well, I'm a Taurus, it's about the earth, right? We're earth mamas.
We are. Yes, exactly. But I love that. And I thank you for sharing that. You have to do the practices, like there are 2 things there I heard, and I completely agree. It's probably why we're friends. Is that I can't remember the exact way your teacher told you, but you have to, as a practitioner, be doing the work yourself. I've seen a lot of practitioners not doing the work, and then it's just, I don't want to go down that negative rabbit hole or anything, but I've seen a lot of practitioners not doing the work, and that's why as clients, patients seeking out providers in whatever capacity, need to do some diligence and do that gut check like you talked about, because it is so important. And it's so easy to get caught up in our work days, and this is what we do, we have to do this. But I know personally as well that making sure I'm doing my meditations, though I'm not doing yoga nidra every day, but after you just shared that, makes me want to do yoga nidra every day.
It's amazing.
Probably do it about once a week. do you do the whole 35-minute iRest practice, or what are you doing?
I'm studying Karen Brody's Daring to Rest. I'm in the Daring to
Ooh.
Rest Academy
Okay.
training right now.
Okay.
So it was a force to do it, which has been an amazing journey to. I'm doing yoga nidra once or twice a day.
Wow.
And then training to be a facilitator for her work. So
Okay, great.
I've done one level, you know this, but
Yes.
I've done levels 1 and 2 for iRest. So this is my third training. I don't know, I come in three trainings.
Yeah.
For,
It has to be.
but it's a different philosophy, and she
Okay.
adds pieces like a touchstone. It's very feminine work,
Ooh.
which was a softer way. I love Richard Miller's work. He's very trauma focused, but this is a little gentler, more subtle and it's geared for females.
Oh.
And I was going to say on the piece of, doing your own work, Molly Burkholm, who was my level 1 iRest teacher, talked about when things come up with clients that touch you and affect you, then you know that you have work to do in there. So if we're aware as practitioners of something that comes up in a client that's like, ooh, that kind of, Richard Miller calls it sticking to you. If you go in a room and they throw paint on you, and it should all come off. And if it doesn't, then that's your work. So Molly does Warriors at Ease and does lots of work with the military and post-traumatic stress. They've removed the D. If people don't know that, it's not PTSD anymore.
I've been hearing that more and more.
Yeah.
Yes.
Because it's not a disorder.
Yeah.
It happens to so many people.
Makes sense.
But it's about doing our work. Otherwise, you get triggered in your own work as a so I will say to you, looking for a practitioner, you don't want to go try to release some of your stuff and trigger a practitioner because they're not doing their own work. And I'm honest. I mean, like I say, brain disorders, those things are not my forte. People ask me about strokes and Parkinson's, and I say I do some chiropractic with some of those patients, but that's not my specialty. So I want to find somebody that's good. I love doing triage and I know so many practitioners that I can help people find other people to go to, because we have specialties and we have interests and passions, and
yeah, and we support one another as well.
Right.
We don't all have the only expertise. Like, that's why I have guests on my
Right,
show.
right.
Like, when I decided to do this, I was like, at least 30 people came. I wrote down of people I wanted to interview and share their work, because I refer people all the time. Like, my specialty is women, chronic pain and trauma. That's who I work with. So, I refer out as well. I'm not trained in craniosacral therapy. I'm not trained in chiropractic. I'm not going to pretend I am. So I'm going to refer out. But it's very pertinent to really pay attention to who your providers are. I've seen some of the not so great side of certain practitioners who aren't doing the work themselves and trying to heal, and there's air quotes going on as I say that. And so because we are guides, we're mirrors, we're facilitators, not healers. And even though, like, this year I had to go through accepting that I do have those gifts, but I still have hesitancy in calling myself a healer. That just doesn't sit well, because I was always taught I'm a guide and a mirror. And that's how I approach my practice as well as a yoga therapist. We'll make sure to link in the show notes to Daring to Rest, because that sounds amazing, and I'm excited to explore it myself. So thanks for sharing that.
She's doing a 40-day program. You can buy her book, and then you can go on the Sounds True website and download the 3. It's Rest is the first part, Release, and then Rise. So it's all about rising rooted.
Get her on the show.
Oh, she's fantastic.
Oh, thank you for sharing that,
Yeah.
Cheri. I really appreciate it. Any final thoughts?
No, I would say trust yourself, trust your gut, trust your body, listen to your body. We're not trained to do that in this culture. The one thing that I wish that we would have been taught as kids was to figure out how to deal with our emotions, how to express our emotions, because we've all stuffed it. We all come from a keep things secret, don't tell things about the family, and we all have similar stuff in every family. I think our generation is bringing this to the light, like we're all jacked up and it's okay. And so it's when you feel something in your body, feel it. Instead of stuffing it, just let it bubble up to the surface and feel it. And it doesn't feel good. Doing the work sounds great on a podcast. It is not pretty when you're by yourself and, working through things. But it's a lot of energy to keep them stuffed. Way more energy than it is to let it out, because you can let things out in a 2-minute, 5-minute, hour session, and then it's out. And it's freeing. It's just like a secret. Once you can tell somebody that freeing feeling, and it's the same way every time you let things go that have been stuffed in your body for years and years. So
and it truly transforms your life.
It does.
I mean, it is worth doing the work. It's not always pretty. It's not always easy, but it's worth doing the work and growing in that capacity. I mean, I know for myself, it's just amazing and transforming.
Yeah.
So thank you for being on today, Cheri. I really appreciate it. I'm excited to go to lunch and talk some more outside this podcast. So we're here every week on Thursdays, and just check out all the links in the show notes, and we'll link to Dr. Brown's website as well, with Moving Towards Balance and all the work she does. And we appreciate you being here. Tune in next week for another Wild Wisdom podcast. Wild blessings.